Hey, my medical coding family, how's everybody doing today? Happy Saturday. Medical coding family, how's everybody doing today? That Alpha Echo. Hey, go kart. How's it going? Y'all ready to practice some practice questions? Definitely a question that will 100% be on the exam. Is something a whole lot like that one. Y'all let me know in chat what you guys think is the answer, and we'll move on to the next question. Hey, go kart. How's it going? Good to see you. Go kart likes answer A. Perfect. Good job. What about this one? If a star is next to an E&M code, what does that mean? What do you guys think? Just type in chat. What do you guys think is the answer? If it's a star, it look at the bottom left-hand side of any page in your CPT book. New codes are red dot, so it wouldn't be A. Yep, D as in dog for telemedicine codes. Perfect. Ooh, musculoskeletal. If, let's see, let's see about these. If your CPT code starts out with a 2 9-4. It has one meaning, but if your code starts with a 295, it has a different meaning. Does anybody know what those meanings are? Hey, Nay. This is what you call, let me show you how to get there. So if you come to my website, Medical Coding by Jen, you'll see this picture of this lovely lady right here. If you come to my website and scroll down, you'll see there's a purple box that says 750 practice questions. If you'll click on that, it'll take you to this page where you'll click on medical, and then you can click on AAPC CPC, and it gives you access to 750 practice exam questions in the same format that is the AAPC practice exam. It has a pass guarantee also, and it has really good rates. For 750 practice questions, you can get it really inexpensively. So it's pretty cool. I pay for a year in advance, so it's only $7 a month, but you could do 3 months, cancel your subscription the day you sign up, and have access to 750 practice questions with answers, rationales, and page numbers where the answers are inside the CPT book. And it's really cool. For $40, 90 days access. It's great. Love it. But the differences between the 94s and the 95s, right? So if you guys are on YouTube, you got a much better view than you do if you're on TikTok. But just to show you guys the difference between, look at right here, the 94s is that it's casting supplies. And then if it's a 95, you're in splints. Utilizing your table of contents right before the CPT codes is really handy option on in your textbook or your manuals. So now looking at these available answers, I know that C is dealing with a cast, right? But that D, B, and A is dealing with a splint. Just knowing that information and then looking at your question to see what they're asking you to code for is really handy. That'll help you eliminate some answers really quickly so that you can get rid of them, and then you can go run to those available codes, see what the differences are, and have a faster chance of getting the correct answer. We'll see. Maybe that works a little bit better. Isn't that handy dandy? I love the fact that when you use that table of contents that it works really, really well. Let's see. That's still not working. Let's see. That should work. It probably just didn't work just while the camera was on. I'm not sure, but it should be working just fine. Perfect. Enium. Are we admit hospital? Are we admit or discharge? Why I'm echoing. Thanks, Tiffany. Glad you can hear. Or are we doing just a discharge only? What do you guys think is the answer? I am streaming on YouTube also, which might have a better view. What do you guys think? Admit only because our observation care was less than 8 hours. We have a guideline that we need to know about, that if we are not in observation for at least 8 hours, we cannot bill those combo codes. The patient was not discharged yet, so we cannot code for a discharge. Yep. What about this anesthesia question? I just did, because we've got a guideline that goes with it that says you cannot bill for a observation if they have not been in observation for at least 8 hours. So if you'll look at your codes for observation in your E&M book, you even have a table inside your CPT book, page 22, that says the only way you can bill these observation codes is this one area where you are greater than 8 hours, right? Anything less than 8 hours is admit only. Yes, it's being recorded on YouTube. What do you guys think about these anesthesia ones? Everybody saying A? Perfect. What about, prolonged services? Don't forget you got charts in the prolonged services area too. These are in the E&M section in the front of your CPT book. What would you bill for these? Got some charts in your CPT book that you guys can utilize for this question. Thanks for sharing the live. Thanks for your tappy taps and the heart me's. What do you guys think is the answer for this one? For an hour and a half. How many minutes is that? We're on page 32 of your CPT book. Just looking at that little chart. It says it was an hour and a half. Still don't see a correct answer in chat. Here we go. Hey, MK. Good to see you. Correct. B is correct. So if you look at this chart, an hour and 15 minutes is where it starts that you need to add the additional code, the 59. So an hour and 30 minutes is right in between that hour 15 and hour and 44 minutes. So it's one number each, right? So you've got the 58 and the 59. They're just not times. They don't start timesing the second number until you hit a minute and 45 seconds. A minute 44 seconds is just the 59 once. Hey, Jess. How's it going? If we're doing disability insurance, what is our correct answer for this one? We'd be around page 44 and 45 of your AMA CPT book for 2026. Nope, not your 56. It's your 50. See how it says work related under 56? And 50 says disability. Disability. 50. 56 says work related. This disability could be from something else. It doesn't have to be disability due to work. That's just a lot of people get disabled just being born, right? It's not a job related exclusivity thing. All right. Anesthesia is our next one. Yep, my boot camps come with 6 CEUs and my workshops come with 1 CEU. So do my duck classes. The 2-hour duck classes come with a CEU. If you're at my website, Medical Coding by Jen, you can go to, of course, AAPC. If you go to AAPC, you do the drop down menu at resources. And you go to, maybe they moved it over to certifications, education. Yeah. Go to education, go to search for CEUs, drop down over here to low cost CEUs. You get a ton of CEUs free from AAPC. Once you get there, there's free CEUs at your chapter meetings. Test Yourself has 12 CEUs. members only website webinars. When you click on that, it gives you 5 CEUs. Just by watching those videos, there's 5, 6, 7. Well, look, there's 1, 2, 3, 4, 5, 6 CEUs completely free right there. Just watch the videos. Those are 6 that are free. And then if you do all the web-based training at CMS's website, that's 11 more CEUs. You do each one of these, that's 11 more CEUs. So you shouldn't have to pay for any CEUs. There's tons for free right there on AAPC's website. But yeah, my boot camps come with 6, and my workshops and 2-hour duck classes come with 1. You're welcome. You're welcome. You're welcome. What do you guys get for this anesthesia question? We have an 80-year-old. That 80-year-old automatically gets the 99-100. So you know you can get rid of 2 answers right away. And it's just a difference between the 10 and the 32. Perfect. The CMS website link is also on the AAPC website. So I got there directly from here. I just clicked on the green banner. Just click on the green banner and it takes you straight to CMS. You click on the red banner and that takes you to their free videos. You click on the orange banner for the 12 CEUs that you get through the magazines. Drop down menu to the 2025, and you need to do June, July, August, and September from last year's magazine articles. And that's a bunch of free CEUs right there too. All that came from the AAPC website. Okay. Click on the other banners and be sure to watch their little videos. At the very end, it'll give you a number that you key in to your CEU website thing. Yep. Hey, hopeful coder. I saw you on all day today, studying away. We got 228s for all available answers. Some of our differences, like the 56 is a total disc. Our 52 is a removal. 49 is a reinsertion. And 59 is also an insertion. So what did you do today? What did you do today? Everybody saying B? A reinsertion? Perfect. Easy peasy, right? Back to anesthesia. We have an age, right? One of the first things you should check on. And if you have somebody, whoops, who is, right, younger than 1 or older than 70, we'll need that code. So that lets you go to these available answers and get rid of anything that does not have that code in it. Then it's just a difference between A and D. Makes things a little bit easier for you. Are 14 and 16, right? One of them's a repair. What did we do today? Perfect. D is correct. Good job. Excellent. What about this one? We've got our, they're all starting out with the 006s, so they're probably all underneath pretty much the same header. Go check that out. 04 has a different mama. 25 is its own mama, which is cool. 40 is its own, and 70 is its own. So just be sure you're looking up at the 04's mama code to verify you're in the right area, whatever you're doing, because 04 is cervical spine, and you wouldn't know that unless you went up and looked at its mama code, which is the 600 code. And then the rest, I'll tell you the differences. The 20 is thoracic, 25 is thoracic, 30 is lumbar, 40 is a manipulation, and 70 is spinal cord. What did we work on today? Ha, they tricked you. It's 40. Somebody said 25. 25 is a procedure, right, of the thoracic spine, which is not manipulation. That's putting somebody under anesthesia and also doing a procedure on the spine and the cord. You'll notice that 40 does not have anything to do with the spinal cord. If you pick 25, you were doing something on the spinal cord also. Manipulation is inside your 40. It's the third word. And that's all you were looking for to match up with this one, right? Mm, that helpful hope. All right. The 008s versus 009s are under different body parts. 3 of your answers are under lower abdomen. And one of your answers is under perineum. Which body part are you under? Perfect. Good job. Ooh, E and M. Are we doing a consultation? Are we doing an admit consultation, in the hospital consultation, a regular office consultation, or a regular new patient office visit? Which one? What do you guys think? $30? Everybody's in chat saying B. Is that what TikTok thinks too? $30 is a 42. I don't know. You tell me, Hope. Is it a consultation? A new patient was referred to by their PCP, and the doctor is going to write a letter back. They did a straightforward MDM for about 30 minutes. 30 minutes is under the 4-3, but straightforward is under the 4-2. Ooh, what's this tutor feature that just popped up on Pocket Prep? It says tutor. Good afternoon. Want to talk about this question? Ask something about it. Ooh, what is that? Let's see. Time is 99243, but MDM is 99242. See what tutor says. You're right. Tracking. You're on the right track thinking about both time and MDM when coding E&M services. Remember that you can use either time or MDM to select the level, but you have to pick one and apply it consistently. Looking at the question, which of those two factors does it give you clear, specific information about? So with time, it says about 30 minutes, but with the other option, it says straightforward, right? So that's why straightforward is correct. Yep. Very cool. I like their new little tutor feature. That's pretty cool. But also, when you hit the show explanation, it'll tell you more about the explanation and give you the page number where you can find the correct answer. It'll highlight different words that you can click on and look for definitions too of what they're talking about. Really cool. They've done a lot of work of updating Pocket Prep and make it a lot more interactive and um, even more helpful for sure. Love it. And for $8 a month, you can't beat the price for 750 practice questions. Lord, I love it. All right. Are we in integumentary doing something, or are we just in musculoskeletal? Hey, Crystal, how's it going? We're just playing around with some of the new features of Pocket Prep. Don't forget, if you guys want to go there, just go to my website, medicalcodingbyjen.com. And right below the lovely lady's elbow here is our Pocket Prep area. Just click on that. It'll take you here. Click on medical. Top link is AAPC practice questions. Pretty cool. And you can put this phone app on your phone, or you can do it on a PC like I am. But it's really helpful to do practice questions while you're in the grocery store, on your phone, or whatever. You can practice the process of elimination. Also, even when you don't have your books with you. 3 of our available answers have the 20103 code in it. Which is a child code. You can't do nothing with it. You got to go find its mama, which is 20100, which is an explorer of a penetrating wound. Is that what we had today? Being stabbed is a penetrating wound for sure. The O3 is an extremity. What is an extremity? Is that a right arm? Not long enough. What do you want? I'm not leaving the house. You're you're just a gambling fiend. Yes. What housework have you done today for your home? What have you done? Have you done anything? No. No chores, no nothing. Yeah, you could. I'm walking through cat litter. You could do towels that need washing, about your own laundry. Yeah, 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 yeah. Remember, don't dry that hoodie. Coming inside here. I want some more Pokemon cards. Lord. Anatomy apps. Miss Vanessa. These manuals that you guys have already bought have all the anatomy in it that you want or could need. What AAPC is going to test you on is how to use this book, right? So, in the front of the book, where it tells you how to use the book, they give you the anatomy that's the differences between your exam questions or your CPT codes, right? Remember one of them just a few minutes ago was a plexi that told us that, or a plasty, that that particular CPT code was a repair. The other one was just a puncture. It ended in ESIS. All your anatomy you need is right here. If you understand the differences between peri, sub, intra, infra, extra, distal, proximal, and the different endings of all your surgeries, this is all the anatomy you need. And then your ICD-10 books, right? If you get AAPC's version of them, at least, it comes with, of course, all the anatomy pictures that are great reference tools. But before you code any section, it has all of the anatomy that they actually get their questions from right before you code a section and all the common diseases. This is where they get all of their questions from right before you start coding a section. And if you know how to use your manuals and know where your stuff is located, that's all you need. The other thing I recommend is just go into Google, and every beginning picture of your CPT book has an anatomy picture. If you just write down the function of everything that's labeled there, then you've got everything you need for an anatomy exam and you didn't spend any more money. You're welcome, Vanessa. I do have in my website, of course, some stuff you can buy. I love my anatomy coloring book. I got this back when I was in college and back in the 90s, and I love this thing. You just color code, and it's small, it's not big. Um, if you ever wanted just to color and learn things, I do love this book because it's got the small little paragraphs for the functions of each body part. So if you wanted to know what each little thing does for function, it's small. It tells me in small things. I love that anatomy book. And then it's on my website if you want it in the store. And then I've got a medical terminology pocketbook that I loved too, that I used when I did A&P years ago. But these are the only two things that I've ever had outside the manuals. That's all. Yeah, I love that color book. But you don't need it. We got enough to color in our CPT book. But it's fun. Some people love coloring. Everybody says A for this one. Perfect. And it's saying our page number is 129 for that one. And then you can define all the terms in there. What does it mean by a distinct procedure? What is a wound exploration? What does it mean by what guideline am I dealing with? It tells you all that stuff now. How to cross reference, where is the CPT index? What the heck are they talking about? All that kind of stuff now in your rationales. So it's really cool. All right. Yep, it does. All right. Are we doing a hospital consultation, an ER visit, a critical care service, or is this a way woo, an ambulance, right? It's got the 88 at the end. Every time I see the 8 and the 8, I think of the tires on an ambulance going round and round. I don't know. But that's how I remember some of the codes, is associating them with each other. Relaxing for me to color and learn them at the same time. Yep, me too. And then, in the front of the book that I was just showing you off, that says, the differences between the CPT codes, the intras, the infras, all that stuff. These 2 pages. This is what I make my color codes on, right? If I'm doing anything like what's trans, what's supra, what's infra, extra, that's what I do my color codes for my differences between my CPT code descriptors, right? So we got retro, we've got extra, intra, all that kind of stuff. I just color code them based off that stuff, right? Super cool. And then I can tell my differences between my codes and know what to look for in my exam questions really fast instead of just a book full of black ink. Everybody saying D on this one? We're going way woo, way woo. We got an ambulance? We do. Perfect. Good job. And our answer is on page 26. But this is pretty cool. You can see your definitions for inpatient consultation, your critical care services, all that kind of stuff. And your rationales now. Very cool. What do you guys think? Another ambulance one, or anesthesia one, I mean. Is our patient a P1 or a P2? Do you know where to go for those definitions really quickly? Should be on page 65 of your CPT book. P1 is a normal, healthy patient. P2 is a mild systemic disease. Does this patient have some underlying disease or not? If they don't, then you can get rid of a certain available answer. This one's not even noted with a patient condition. And then you just need to know if the anesthesiologist did the anesthesia themselves, or is that information missing? That's right, Miss Hopeful Coder. She's been online 24/7, helping out others that are trying to study in this area while she studies, trying to learn. My FYP has been showing me her lives. What do you guys think? I totally have not been live enough. My whole system is not working out 100% up to par. I got to get my kid in here to help me fix the audio and visuals because I've messed it up or something. But I hate it when Windows updates and then it messes with all your settings. All right, guys. What do you think about Dr. Reese here? I like to look at the available answers and think about, would I see a code that's coded by itself times by something like in answer A? Or do I normally see something like answer D, where there's two numbers combined and the second number is times? What would be more likely a correct answer? We can go to our 27692, the second code, and you can look and see what type of code it is, because in the front where it tells you about those instructions for how to use the book, right here, it also tells you about the types of different codes that they've created, how to add modifiers, when you need to add modifiers, and when you need to times them, right? With examples of what they're talking about. It's really handy to understand how they made the book in the first place before you run to the codes and start trying to code without having to read those first few pages. I recommend finding your own examples that aren't noted of whatever they're talking about in the front of the book so that you can find what they're talking about all by yourself and know what it looks like on your own when you see it. So, like for this one, our second code is 27692. You know that has a plus symbol in front of it. And that means I got a puzzle piece on TikTok. Oh, I can't do the puzzle. Um, that means that that code never gets a modifier, right? Not the 51, not the 50 especially. And it is one that we will times for each additional tendon if we have multiple of two. Our initial tendon will be our first code, right? And then our second or additional will get those codes. So how many did we do? We did anterior, tibial, and flexor tendons. Don't forget to check out, your mama code to see what she's included, right? Because we've got anterior tibia extension, right? Extenders inside your little brackets. C is correct. Perfect. We're on page 188. Yes, yes, yes. Tells you the definitions of what is an add-on code. How do you cross-reference? Where's the index? Where's the main term? Where's the subterm? How do you know about not adding the 51 modifier? Very cool little additions into Pocket Prep. Love it. Or page 69 of the 2025 book. Okay, perfect. Another anesthesia one. We have a 2-month-old. If they are younger than 1 year of age, sometimes you might utilize that age additional code for anesthesia, right? That one right there for younger than 1 year of age. But you got to be careful. If your CPT code descriptor has an age in it and it says that it's less than 1 year of age, then you do not add that one. Only if the code descriptor does not have an age in it. So with younger kids, you have to be careful. But with anybody older than 70, you can always add that one. The 007s are under one body part, right? B is under upper abdomen, where 008s are going to be under a different body part, lower abdomen. Do you have your body parts? Do you know what organs are in which part of the body? I like to draw an anatomy quadrant, draw in my different body parts. Where's the spleen? Where's the gallbladder? Is it upper, lower? All that kind of stuff. D? D is correct. Perfect. We're on page 69. Ooh, we got some new codes. If you don't have the 2026 version of the AMA CPT book, these codes may not be in your manual. I do have a document on my website that you can get that will turn your, let me turn that and then go to this and go to this. So if you're on my website at Medical Coding by Jen, you come over to the More section, drop down menu, and go to Notes and CPT Guides right there. Just click on that page. You'll come across all these notes, and right there is the notes that will turn your 2025 CPT book into a 2026. That's really handy because for this question right here, you just write in the codes and the descriptors that are missing and exit out the ones that are not valid anymore. And then that way you've just got the correct answers in there if you need them. All you need is the numbers and a brief description of what the descriptor is talking about. It's not hard. This year wasn't too bad. There was a lot of new cardiovascular, some new E&M codes, and some new radiology. I think the one that's on the question is, or on the certification exam, is the one about 4 minutes. And the answer is about whether it would be the 90816 code or not. We just don't report any services that are less than 5 minutes anyway. "13" is 10 minutes, and it is for an established patient with low. 12 is 10 minutes, established patient, straightforward. 11 is new patient, 10 minutes. Got to be at least 10 minutes, up to 60, right? And number 8 is also new patient, 45 minutes. First, figure out if your patient is established or new, so you know they're not new, so you can get rid of these two. And then for your established patient, your times are 12 is 10 minutes and 13 is more than 10 minutes. Yeah, correct. If it's less than 5 minutes, you can't bill. Or you can add it into the next E&M visit that you have with the patient. What about time? Reporting is an extremely important for anesthesia building. When does anesthesia time end? Is it after the doctor stopped working? Once the patient is taken off anesthesia? Once the patient returns to his hospital team room? Or once the anesthesiologist is no longer in physical attendance? What does it say? In our AMA CPT book, it says when the patient may be safely placed under post-operative supervision. Yep, D is correct. Perfect. Nose fractures, usually on your certification exam, for sure. I'll stop TikTok since there's only 3 people on it. We'll continue on YouTube. This phone's about to die anyway. It needs to charge. always doing these nose fractures on the exam. B is correct. Good job. I and D. I and D. Sometimes an infected wound or an infected fracture is a different set of codes than just a normal fracture or a normal IND. So be careful with some of those. Sometimes it's a different set. C. Perfect. Excellent. Your answer is on page 187, and it's got lots of definitions. Biopsy, soft tissue, superficial, deep abscess definitions versus a hematoma, what an infected bursa is. So even if you don't have the definition of what a bursa is, that'd be great to add, right? Super cool. Love all the additions that they've done. When a physician reports the scope removal of one or more loose foreign bodies, what do we do? Removal of loose foreign bodies may be reported only when they are equal to or larger than a certain denominator. Is that what's correct, Go Kart? We got the word only in that available answer. Foreign bodies may be reported only when they are more than 5. Removal of loose or foreign bodies may be reported smaller than 1 ml, or there's no restrictions on removal of foreign bodies. Do we need a certain size? You got something stuck in you? Don't forget that if you happen to have a guideline with a set of codes, it will have a little star beside it. So if there is a group of codes without a star, then there is no guideline that you need to worry about. But when you do see a star next to it, then that guideline will be right there, right before that first set of numbers right there. Um, and if you need one, it'll be there if it has the star. There's a group of codes with no stars, then no guideline you need to worry about. Still some A's and D's and some B's on this one. Let's see. We've got for our scopes, if we're going to have a foreign body removal, scope removal of foreign bodies may be reported only when the loose bodies or foreign bodies are equal to or larger than the diameter of the scope going into the body. That's on page 199. Number one thing I love about Pocket Prep, it tells you where your guidelines are at. Right there, may be reported. If it's these codes right there, may be reported if whatever they're removing is bigger than or equal to or larger than the diameter of the scope. Very cool. Very cool guideline. But it would have told you in the front of the book, right? That's 297.9, somewhere around there. What are those code numbers? 298. 298. If you went right there, it would have told you, yep, we do have a guideline you need to worry about. It's going to be on that page number. So you go to that first guideline or first code number, and that'll tell you where the guideline is if you don't have Pocket Prep around to tell you where the guideline is at. Very cool. What is the definition of a consultation? Is it a follow up? Is it a request? Is it consent? Or is it any? What do you guys think? Yep, B is correct. Good job. Can't do this one. All right. Ooh, these 100% will be on your CPC exam. If you don't know your differences between your joint repairs of your torn ligaments in the knees, you really need to get really good at doing these questions. I have a bunch of them on the YouTube channel too. So, like, if you guys are on my website and you go to the free resources tab, social media, of course, YouTube is right there. Don't forget to click over on these little tabby things. So if you're looking for the podcast, it's under podcast. If you're looking for a playlist, like where's my duck classes, or the book prep videos, that kind of stuff is right there. For a lot of you guys, you have the YouTube membership where if you want to watch me do the ICD-10 guidelines or the CPT book pages, don't worry about what year I've recorded these in. It makes no difference because the codes don't change, the numbers don't in their definitions. So these are wonderful. Just click on the words that say the view full playlist. That's much easier than clicking on the first video. Then you can look and see which video you want to watch, like cardiovascular, or if you want to go down and do a different subject matter. anesthesia or whatever. I have a blue zillion of them. But the other cool thing that I have here on the YouTube channel is the post page, which you won't see it like I see it. I see it with the correct answers and the rationale. But when you guys see these questions, it's nothing but practice questions. Click on what you think the correct answer is on, physically click on which one you think it is. Then it'll give you the answers and rationale. I have a lot of them, a lot. Just keep going and keep going, and they're totally free. I think everybody can access these. They're open to the public. I could restrict them to just the membership. I might one of these days, but these are really, really cool, and they are free for everybody. And I have a lot of Moz surgeries and a lot of the knee surgeries in here. Really helpful for you guys too. But yeah, tons of cool stuff in here. But even more knee practice questions there, totally free for you guys. Let's give away some of those YouTube memberships. Out of the people that are here, if you are not signed up for a YouTube membership, I'm going to give away 5 for free now. Good luck, everybody. I don't pick the winners. I'm just sending YouTube some money, and they are going to pick 5 people that have been in chat to be winners. So now, uh, Han, Holly, AMR, Queen, and Kristen all have free memberships to my website for the next 30 days where you got access to all my book prep videos. The duck classes are excellent, and all the podcast of me reading the guidelines. I hope that helps you out, guys. I give away 5 every time I go live, so what do you guys think is the answer for this one? We're doing a repair with sutures. The duck classes are 2 hours of, like, if you didn't pass the first attempt of you taking your CPC exam and you want to know what you did wrong on the exam, you've already studied, you've already prepped your book, and you took your first attempt and you didn't pass. What did I do wrong? That's what those classes are for. Not really for like beginner, like I don't know what I'm doing, but I'm prepared and my book's prepped, but I can't pass the exam. These are the tricky questions that most everybody gets wrong, no matter what. And I show you how to handle those and what the differences are between those code descriptors so that you can pass your exam. I got B's and D's for this one. So what's our differences? Our D is one side. We only repaired one side. Our B is we repaired both sides. Problem with these codes is a lot of times we'll go in on a good side, like the lateral side, but we didn't do a repair on the lateral side. We only did the repair on the medial side. So look at your question. Did you repair both a medial and lateral side? Did you both fix both sides? Or did you only fix one side? And or ors, that's right. It was just the or. We only fixed one side. Answers are on page 202. What about our deformities? Posterior is usually a key word. Some of the procedures are anterior, some are posterior. How many segments did we repair? Whether it was congenital or traumatic, those can all affect the code selection. '19 has a different parent code than the 12 does. Make sure you're under the correct parent code. This one is anterior. D is anterior. We did posterior. So is the O2. It's anterior if you look at its mama code. Posterior versus anterior. And then how many did we do? We did 8. Yep. C is correct. Perfect. Page 154. And you can see the definitions of what these types of surgeries are and the differences in the explanations. Very cool. Are we a new patient or are we established? And are we doing a consultation? Those are our main headers for our E&M categories. Knowing your categories for each number by sight is really handy dandy. I have a set of flashcards that are really handy and a free set of E&M flashcards that you can do interactively on my website underneath the resources tab, which is really handy. It's just testing you on the category headers of each E&M code so that you can know them by sight, which will help you on your exam. Does that change anybody's answers? Okay, there we go. Perfect. Page 16. You can see your definitions of new patient versus consultation versus your moderates. Very cool. Anesthesia. Remember, your body parts will change when your numbers change. So the 018 is usually one body part, and your 017 might be another different body part. Upper arm and elbow versus 018 is forearm, wrist, and hand. Think about those category headers first. Where is my body part? Where am I located at? That is really handy. Knowing that the numbers correlate with the differences between body parts, really handy for the CPC exam. A is correct. Good job. Page 72. All right. Is our patient established or are we doing conferences? If we are doing conferences, what's the difference between those two codes, the 68 and the 66? 66 has no MD, and 68 has no MD also. 68 has a parent code that tells us we're doing a team conference with no patient. 66 says we're doing a team conference with patient but no MD. They're on page 35 in the 2026 book. I don't know about the 2025 off the top of my head. They're right after prolonged services. So look for your 99417 code. Do you know where that one's at? They're right after that. Right after your standby code. Everybody saying B? B is correct. Ooh, more anesthesia. How old is our patient? 75? You know our 75s need that special number, right? So we can get rid of A and B right away. We cannot, utilize anything for anybody older than 70. We have to have that 99100 code. Now, would it go first or would it go second? And would a 75-year-old ever be a P1? I mean, I'd love to get to P1 and never even have hypertension or even a chronic sinus situation. That would be awesome to be a P1 and be 75, but how likely is that, right? So we'll know automatically that our answer is C with this one just by knowing placement of codes and the likelihood of a P1 at that age. Just kind of cool. Yeah. Page 70, but also page 872, they're saying, for some reason. I wonder if that's in your Hip Picks book, where that guideline's at. Another anesthesia. We got an 11th-month-old. We can't tell if we're going to be able to add that 99-100 code to it yet unless we look at the code selections, because some of our anesthesia codes might take into the effect that they are for anybody younger than 1 year of age. So I can't use that trick for this one. But P1 and P2 might be helpful. This kid does have sickle cell and has a cleft palate. How likely would that be a P1? What's more likely a correct answer? Sickle cell is lifelong, right? Cleft palate we can fix in general, but everybody saying C? Perfect. We're on page 65 and 66. Not too bad of a difference. You can and probably need to add the new codes into your book if you can. If you do go to my website at Medical Coding by Jen, come over here to the More tab, hit Notes. It'll bring you to this page. Right here is a set of notes that will turn your 2025 book into a 2026. You can instantly download that and then change your book into a 2026 book, which is really helpful for your exam. What category of surgery would we be working under for this diagnosis? Feels really light. Fragile. I don't know. One of them might be. Fragile. We're getting mail delivery. Ugh. God, if these people stop sending me bills. That one for Grandma. That one's for Grandma. Ooh, that's for James. You starting to get bills too. This one's for Grandma. Yeah, that's what happens when I got to take you to the hospital for a patella dislocation, right? Yeah. A. Perfect. Answer is on page 161. Do you want to see? Yeah. Okay. You have to hang out. Let's see. I need a blue light. I need to see if it's real or not. And I need a blue light. I need our scorpion light flashlight, wherever it went to. Oh, this is something new. I got it free from the TikTok shop. You know the book that I got? Oh yeah. They sent me a cassette tape for the music that goes with the book. Sure, you can get like a little app on your phone, like a UV light something on your phone. Can you? That's crazy. Sure there is. TikTok shop sent me a cassette tape with some music on it. I gotta make a video on. They sent me the book that goes along with it. It's something about Dungeons and Dragons and Pokemons and I don't know what all, but that's what we're discussing over here. But too cool. I love the TikTok shop. I love getting items for free. Now this thing, I can't believe they didn't send it insured. But yeah, to see if it's real, I gotta have a blue light. I know the number's right. I've already looked it up online, and that number, oh yeah, rated 10. Uh-huh. 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 You got a Gengar yesterday. What are you talking about? Yep. A new Pokemon card in the mail. Oh. It's no Bubble Mew, but the card of the decade right there. Keep your mouth shut. Don't tell. It's a Christmas present. All right. What are we doing? We got a new patient or established. What are we doing? Let's see. It does say established right there. So we can get rid of those two. Then we got to decide, which is the hard part. Are we a level 2 or a level 3? Either go by minutes or amount of data. What are we doing? We got an unknown outcome diagnosis. And we're sending them for 2 tests to be done. I want to say D, but I'm not sure. Let's see. Correct. Good job. They're saying the answer's on page 16. They're saying that this one's based off 20 minutes. So maybe they just went by time. About 15 minutes. Ugh, I hate that. The descriptor says 10 minutes must meet or exceed, so we're doing okay with time with that one. So good job. Do we have standby services or something else? 416, is that a wellness or something? And what is this, a consultation or group? Group something? Group? Probably standby, huh? Can y'all even find the code 99360? That sucker's not easy to find in the E&M section, let me tell you. They're just like all over the place and they're put out as whack because of other codes are in the way. That code is in between a 99417 and 418 and a 99366 code, even though it's 99360. It's crazy. It's after your 99415s. It's after your 99359s. It's even after all of your home resident visits, which are your 99341s. That standby code is just out on its own in the middle of nowhere's land for no reason. I think it should be moved with our NICU babies, right? Wherever the NICU baby codes are at, because that's where it's used most with, instead of over here in no man's land. It's on page 35. Some people are saying D, some people are saying C. Each 30 minutes, you have to meet or exceed time to be able to bill it. He does stay an extra 30 minutes because the C-section did take longer, so that is 2 30 minutes, and that is correct. Good job. Are we new or established? Oops, sorry. I meant to cross it out, the new patients, and get rid of them. Is what I was trying to do, but I accidentally clicked on it. So you are correct with your D's. More muscular skeletal. Are we doing a scope on a jaw? Where would we be? All your numbers, yep, are except for these two, have different first 3 digits. That means they'll be under different body part or surgery type headers. Make sure you're under the correct body part and the correct surgery category, then pick your answer. What do you guys think? Y'all saying C for this one? Checking those header categories, right? 298s are underneath this. If we go to our 212s or 210s, right? Right? Thinking about what their headers are under. 21210. That means we're underneath this kind of, and we're under that body part, right? Makes a difference. Those are the only ones that are underneath that scope word, so it makes sense. Plus, it tells you what page number to run to for your correct answer. And then your OO versus your O4 is knowing the body part, right? One's surgical and one's diagnostic. Then there's a parenthetical for an open procedure, which is right there. Did you cut open the body and do it inside, or did you use cameras and do the repair? Doesn't look like we have any reason why we were in there other than looking around. I don't see that we repaired or fixed anything. So I like Amy's answer. They're going to pick 10. They say it was surgical. Why do they say it's surgical? Not a joint one. This one is not a joint one. What? Diagnostic? They're saying it's surgical. Let's see. Uses an endoscope, inserts operative treatment, debridement, or repair, and is coded for a surgical codes series for many joints. It is not an open incision. Is it just because it's a joint, it's always coded as a that instead? That doesn't make a lot of clear sense. They like D as the answer. To 10, 10. Let's try it. If you look at just the available answers and you run to their PPT codes and their descriptors on that one, probably why get it wrong is if you don't look in the back at your index. Let's see. They're saying go to IR. Otomy. Otomy. Yeah. Does they performed an ortho of the jaw, which is the Tim joint, right? And it tells you right there. But you'd have to go to the index to see. See, that didn't say we were doing an arthroscopy. It said that we were doing an arthrotomy. So, back at the question, let me get rid of my camera. See, it didn't say scope. Yeah. Don't assume that the ortho means scope. That's a surgical open incision. Yeah. Good question. Good question. Anesthesia. We're working on the thyroid. Which one would be correct? Anesthesia. What do you guys think? 003's head and neck, right? Our 00 is NOS code. Our 20 code is for the larynx, trachea, lymphatic system, thyroid, esophagus, but for people that are of 1 year or older. Good. 22 is for needle biopsy of the thyroid. And 26 is for people that are younger than 1 year of age. So we can definitely get rid of A. Because this patient is 20 years of age. C is perfect. Good job, guys. All right, I'm going to get off here and go hang out with the kids for a little bit. I got some downloading of some videos to do for my CPC and CPMA course people to add some videos into their course material. I hope today has been fun and helpful. Sorry about any of the audio and visual letdowns. I just not been going live enough to keep the equipment running perfectly. So I need to go live more, obviously, to keep this running perfectly. But I hope this was helpful. The replay will be up here on YouTube. It won't change. It'll be the same link. And y'all can rewatch it all you guys want. I hope this was helpful. I hope to go live again tomorrow. I'll put a link up for the same time tomorrow. And that's tomorrow's Sunday, right? Yeah. I don't have any plans. So we'll try this again tomorrow. Hopefully, I'll have it set up a little bit better. The master exam, they haven't released the exam answer grades yet. I'm prepping to take it again. I really wanted to not pass, so I'm hoping I made like around a 60 or so that I can take it again. So I love taking the certification exams twice. But when I tried that on the exam before for like the instructor exam, I ended up passing, but I didn't mean to. I meant to fail it because I like to see them twice. But I'm hoping that I didn't, so I can see the certification exam twice. We'll see. Um, but I gotta check. I think they were supposed to release the exam results yesterday, so I haven't even really logged on and looked. Let me go look. As a matter of fact, 'cause they're supposed to release them on the 22nd. So that's pretty cool. I'm hoping that I can schedule and take it one more time so that I could see the exam again. Because I can't remember everything in 100 questions, right? But when I see it twice, then I can remember more of the questions. So I'm hoping that I can do it again. We'll see. Anyway, I hope this was helpful. And yeah, I'll check in tomorrow. Let's do it again. Thanks, Amy.